All right, guys, welcome to our Poop Scoop Monday, where every Monday we drop those knowledge bombs so you can get your information you need to improve your gut health. Howdy, y'all. I'm Dr. Islam, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. I work in Lubbock, Texas. Come see us, Lubbock Gastro, for all your GI needs. I'm so excited to see you guys and hear you guys on today's Poop Scoop Monday. We have a great show today. We'll talk about reflux, the causes, the symptoms, and some of the treatments we recommend for our patients. We'll discuss probiotics. We'll demystify probiotics to answer any questions you guys may have about probiotics and what tips that I recommend. We'll talk about Matthew Perry and the ketamine overdose. You may have seen this on the news about how this happened and what the science is behind that. We'll talk about Joshua Ray Parker, 32 years old, and got diagnosed with colon cancer. We'll talk about the 9 drinks that can make you go poo, and we'll talk about what exactly is an EGD and your questions live. We have a packed, filled show today. I want to thank you for watching today. If you haven't watched me before, my name is Dr. Islam. I work in Lubbock Gastro. Yay, come see us, Lubbock Gastro, for all your GI needs. Every Monday, I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, share, and subscribe. Let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well, so I can see who you guys are, and so I can see my audience. Make sure you guys are getting the knowledge bombs that you have today. Well, thank you for joining me today on a Monday night. How was your weekend? My weekend was great. So we are continuing my movie theme. So I don't know if you know this, but I've been telling my audience for the past couple of weeks, I've been trying to watch kind of an older school movie with my family and try to introduce the classics, what I think the classics are, to my kids. So this weekend we watched Runaway Jury. Came out in 2003, starring John Cusack. It is a great movie based on a based on a John Grisham novel. Fantastic, action-packed. It was fun. More importantly, my kids saw it. Luckily, I fell asleep because I already saw it before, so it's okay. But I was exhausted from all the Christmas parties that we had as well. What did you guys do over the weekend? Are you guys doing some sort of marathon like I am? Do you guys have any resolutions coming up? I'm excited to hear what you guys have to say as well. Lori, thank you for watching from Colorado. Yes, so far, Lori, you are the winner for where the furthest is so far. Sorry, guys, my nose is a little stuffy today. The weather changes. It's making me all stuffed up. I hate this weather change, but I do love the fact that it's almost Christmas and it's like summer outside. Hey, global warming may suck for everyone else, but I love it here in West Texas with the warm Christmas that we're having. Hope you guys are having a good holiday as well. All right, let's go and talk about first topic, GERD. What is it? What causes it? How do we treat it? And what are the symptoms from this? A very complex topic. We're going to do a deep dive on this. So what exactly are the causes of GERD? So there are 2 main causes of acid reflux. This is kind of how I like to describe it. There are anatomical reasons why you have acid reflux, and then there are lifestyle reasons why you have acid reflux. So let's talk about the anatomical reasons. So if you have, the biggest reason why people have GERD is a lower esophageal sphincter that's not working correctly, meaning it's open longer and more often. So it's like having a window or door open and all this stuff goes into your esophagus. This is the root cause of why you have heartburn, regurgitation, and acid reflux. A second anatomical reason is having what's called a hiatal hernia. This is where part of the stomach goes above where it should be to cause that valve to open longer and more often. And for a lot of my patients that have a hernia, especially if it's 3 centimeters or larger, this can cause acid reflux to occur. Now, these are anatomical reasons why you have GERD. Let's talk about lifestyle reasons why you may have GERD. So number 1, it could be the foods that you eat. So we know that certain foods can trigger acid reflux, whether it produces more acid or causes that sphincter to be open longer or more often. Foods like chocolate. I know, my favorite. I love chocolate, but it can make acid reflux symptoms worse. Tomato-based foods, citrus-based foods, carbonated drinks, alcohol. Pretty much all the good stuff we enjoy in life can make acid reflux worse. I will have to tell you, though, it's not the same for everyone. So just because someone tells you not to have spicy foods to make your reflux symptoms worse. See how your body feels. So for me, we'll use me as a prime example. I have acid reflux and I hate acid reflux, but my trigger is beef. Whenever I have beef, whenever I have steak, especially at night, I can't sleep because I am refluxing all night. Despite whatever I do, it makes my symptoms worse. So see how your body feels. Another lifestyle reason is eating too late. This is why you cannot eat late. Your body needs time to digest, at least 30 minutes to an hour after you eat. You cannot lie down, because if you do, that food sticks in your stomach and causes regurgitation, fermentation, and gas and acidity to be formed. So this is something that needs to be taken care of. Number 3, eating too much. So eating too much, having too much food, or having a big belly can cause you to have acid reflux symptoms as well. So sometimes when it comes to reflux issues, we have our patients eat smaller, frequent meals throughout the day, or try to lose weight, which is probably the most effective way you can get your acid reflux taken care of. Also, too, other lifestyle things that can cause reflux symptoms to get worse, starting with things like pregnancy, which goes along with obesity as well. All right, what are common symptoms of GERD? So there are 2 main conditions that if you have, I'll tell you have GERD. One is heartburn, which is burning right here, or regurgitation. These are 2 most classic symptoms when it comes to GERD. But you can have a lot of other symptoms as well. Chronic cough can be related to GERD or acid reflux. You have throat clearing. It can be related to GERD or acid reflux. Trouble swallowing. It can be related to GERD or acid reflux. If you have constant ear infections, that can be related to GERD or acid reflux. You see a theme here coming on? It's the same thing over and over again. And so non-classical GI symptoms can be associated or be part of acid reflux and the kind of the heartburn spectrum as well. But if you tell me you have heartburn or regurgitation, that's all I need to do to diagnose somebody with GERD. What's the big deal about GERD? Let me tell you. Now, GERD can cause your quality of life to suck. Absolutely. When I have GERD, it sucks for me. I don't sleep well. I'm in a bad mood. I'm just irritable. It's not good. They can lead to complications. One of the biggest complications you need to be aware of that a lot of people don't realize is cancer of the esophagus. It is such a sad scenario when you have somebody who's had chronic acid reflux who all of a sudden develops cancer of the esophagus. This is why you need to get it checked out. Don't ignore this. Let me tell you a story of a patient of mine. I had a 55-year-old man, long-standing acid reflux, never got it checked out. That wasn't a big deal. Took over-the-counter Tums and Rolaids. All of a sudden, he started having trouble swallowing just a little bit, but enough to cause him, hey, what's going on here? So I did an EGD on him, and I found cancer. And esophageal cancer is one of those cancers that by the time you find it, unfortunately, it typically is too late. It's already spread. It can already cause a lot of problems. So don't ignore your reflux. Get it checked out because you may be at risk for developing complications like cancer. All right. Now that I scared the living bejesus out of you about reflux, what can you do to fix this? Let me talk about my recommendations. So number 1, there are a lot of lifestyle things that actually do work. I mentioned before, weight loss by far is the most effective and efficient way to get your reflux taken care of. If you are overweight, you need to lose that weight. It will decrease your risk of developing acid reflux. It will also decrease your risk of developing complications from acid reflux as well. Number 2, avoid late night meals. Don't lie down as soon as you eat. Wait at least a couple of hours afterwards. Number 3, go for a walk after you eat. That walking will aid in digestion and allow things to pass through easier and help out when it comes to acid reflux symptoms. It actually does help. Next, try sleeping elevated with the head of the bed a little higher. This can help out when it comes to nighttime reflux as well. And sometimes incorporate some of the dietary changes like adding fiber or eliminating those trigger foods can help out when it comes to acid reflux. That's option number 1. Option number 2, we have medical therapies. They work and they are effective. You have the over-the-counter treatments like antacids or things like that, which can help with short-term reflux. You have what are called H2 antagonists, which are medications that are also available over the counter. Think of Tagamet or Cimetidine, which work well. They're not as effective as the PPIs, but they do help out with reflux. The biggest side effect with these H2 antagonists is that they can lose their effect after about 12 weeks. So It's not uncommon for my patient who take these medications to have recurrent of their symptoms a few months later. Then you have what are called the gold standards, the PPIs, the proton pump inhibitors. They work, they are effective, and they help out when it comes to acid reflux. These are what we call the gold standard. They actually do help out. Now, a lot of patients are on these medications, and a lot of my patients are confused about the side effects of these medications. So let me tell you what I tell my patients. And as always, always speak to your healthcare provider about what you need to know. So number one, make sure you're on the right treatment for the right reason. If you're on a PPI and you don't know why, ask your doctor. Don't just take a medication because you were placed on it years ago. Number two, you want to put yourself on the lowest dose possible to control your symptoms. So I always talk to my patients. Let's see if we can maybe minimize the dose as much as we can to see if we can help out with your symptoms. Number three, I always incorporate lifestyle changes to either decrease the dose or minimize the effect of those side effects. What are the side effects that we know of? So you're going to see a lot of things on the news. Here's what we know for sure. Keep in mind, this is not a comprehensive list. If you want me to do a comprehensive video on this topic, comment down below. Let me know. We do know there is a risk of absorption of certain vitamins. Calcium, vitamin D, magnesium, and B12. We know for some individuals, you have a deficiency of that. We also know that for some individuals, especially postmenopausal women, there is a possibility of an increased risk of hip fractures and osteoporosis. Not everyone has this, but it can be. We know for some individuals, you can have an allergic reaction to your kidneys. Not kidney failure, but some sort of what's called interstitial nephritis of your kidneys. We know for some individuals, it may possibly change your gut microbiome. We know for some individuals, it can put you at risk of developing infections like C. diff and pneumonia. What we do know is that it does not increase your risk for Alzheimer's. We also know it does not increase your risk for chronic kidney disease. A lot of people stop these medications because they're worried about this. Let me tell you, don't stop the medication on your own. Always speak to a doctor like me so we can find out why you're on it and get things taken care of for you. But if you have reflux issues, if you're wondering, should I be on a medication? Should I take this pill? Is there other options? Come see us at Celeb Gastro. We can delve into the science of why you have heartburn, but also see my videos. I have tons of videos on this, and join me on my live stream as well where I can talk about this as well. So I hope this is a good deep dive on everything that you need to know when it comes to acid reflux and what recommendations I have. Rayma, thank you for watching. I love seeing you. You're always there, so thank you for watching as well. Kevin, thank you for watching from Southern Oklahoma. Excuse me. Greg from Florida, thank you for watching as well. Lori asked a great question. What about that acidic taste in the mouth? Sorry. Lori asked a great question. Hey, Dr. Islam, that acid taste in my mouth, is that from acid reflux? And the answer is, yes, it is. Absolutely it is. Acidity in your mouth, or that brackish taste in your mouth, is also due to acid reflux. And so if you have that, consider seeing a doctor like me, or maybe trying some acid medication to see how you feel, to see if it controls your reflux symptoms as well. Great question. All right. If you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. I work at Lubbock Gastro. Come see us at Lubbock Gastro for all your GI needs. If you haven't already, smash that like button. I want to see more smashes. I want to see if we can get to 20 smashes. Let's see if we can do that. And if you haven't already, let me know if you're watching this live or on the replay and where you guys are watching this at as well. So far, Greg from Florida, how's the weather there, is the winner for the furthest area of where we're watching that as well. All right. Next topic, stress and your GI health. Sorry, my allergies. Sorry. I'm having really bad allergy attack today. I have no idea why. So let me just kind of get over there right now and drink some water before we begin. So sorry about that. All right. Next topic, stress and your gut. Did you know there is a direct connection between stress and your GI tract? Absolutely there is. Let's talk about this. So what exactly is going on? It's called the brain-gut axis. So it's like a superhighway between what's going on here and what's going on in your belly. Your belly is like a second brain. And sometimes what gets manifested in here gets reflected in your stomach, and what gets reflected in your stomach can cause issues up here. It ends up being a vicious cycle. And so We have to somehow, some way, break that connection between the brain and the gut. Let me know in the comments down below if you've had issues with this as well, or if you suffer from this brain-gut axis. And because of this connection, there are a lot of GI conditions that actually do get worse the more stressed that you are because of this connection. Condition number 1 is IBS. I have thousands of IBS patients who have either diarrhea, constipation, bloating that gets worse when they are stressed. Maybe this time of the year, being around people, the holidays, finals, their IBS symptoms flare up because of the connection between the brain and the gut. If you have reflux absolutely can be stress related. The more stress that you have, the more acidity you can make, the more likely it's going to be for that valve to be open longer and more often. And maybe the more stressed that you are, the more bad foods you're going to eat, they're going to make your reflux symptoms worse. Absolutely, stress can make reflux symptoms a lot worse. We also know that inflammatory bowel disease, Crohn's or colitis, there are studies showing that the more stressed that you are, the more likely it is you're going to flare with your colitis, whether it's diarrhea, blood, abdominal pain, or weight loss. And so we know there's a direct connection between IBD, Crohn's and UC, and stress. And then lastly, just health in general. We know that there is a connection between how you feel overall with your health and what's going on inside your brain. That brain-gut axis, that second brain inside your belly, can actually act on its own and cause a lot of drama to occur in your gut. So if you're one of these people who are suffering from the brain-gut axis, what can you do to get you taken care of? What we want to do is we want to try and see if we can minimize the stress response that your body has. Here are some practical tips that I recommend. Number 1, deep breathing through your nose. Diaphragmatic breathing actually works. What this does, it helps to stimulate the vagus nerve, to slow things down, to relax your gut, and to help out. This is why meditation and deep breathing is so effective when it comes to stress relief, because it actually slows things down. And for a lot of my patients that have gut issues, this works really, really well. Number 2, sometimes massaging the vagal nerve can help out when it comes to the parasympathetic response. Now, be careful when you do this. Don't make yourself pass out, but this can also help out with their stress response to minimize the brain-gut axis. Number 3, going for a walk. A simple walk alone will help out. I did this today. I had a long day at work. Before I did my live video, I went for a 15-minute walk. It was great. Kind of cleanse my body, cleanse my mind of any stress that's going on. So simply going for a walk can work. Our next one is find some sort of meditative practice, whether it's actual meditation, whether it's prayer, whether it's just being alone. This can actually help out. And then also to incorporate exercise. Exercise is free. Why aren't you doing it? It's effective. Why aren't you doing it? It helps out with the brain-gut axis. So incorporate exercise in your diet, in your life, and in your lifestyle. Now, if this doesn't work, I want you to know it is okay to get medical help. Don't be ashamed. Don't be scared. Don't think anything is wrong with you. It is perfectly fine, and it's something that you need. That is okay. Get medical help. Get professional help, whether it's seeing a psychologist, a psychiatrist. Try medications, because sometimes in the GI world, we will prescribe medications for your gut that actually affects what's going on here. And I want you to know that is okay. Nothing is wrong. Let me know in the comments down below. Have you noticed a brain-gut axis for you? Have you noticed that whenever you get stressed, your gut flares up? I would love to hear your comments and what you did and what my audience can maybe get from you to get your stress taken care of. I really want to hear what you guys have to say for that as well. All right, if you're joining for the first time, my name is Dr. Islam. Well, thank you for watching. Christina, thank you for watching. You're always on. Thank you. Marcus, I'm so glad I'm seeing you again. Thank you for watching as well. You are always a great participant as well. Deb, thank you for watching in the live. Rashida, thank you for watching on the live stream as well. And I appreciate you guys being here. If you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. Every Monday, I go live to answer your questions you guys may have. I do deep dives. If you haven't already, a couple things I need you to do. Number 1, get me to 20 likes. Smash that like button. Let's get to 20. 6 more to go. Let me know if you're watching this live or on the replay, and also let me know where you guys are watching this out so far. So far, we have Destin, Florida as the winner from Greg. He's the furthest so far, so I'm glad you watch this. Don't forget to subscribe to my channel, watch my videos, and come see us Love Gastro for all your GI needs. All right. So, next topic, let us talk about probiotics demystified. I feel like I need some sort of like graphic. Demystified. All right, let me know in the comments down below. Do you have questions about probiotics? I think this is literally the most common question I get from my patients about their gut health. So I'm going to tell you straight up, I'm not going to give you a direct recommendation on what probiotic I recommend. I want to give you what I recommend to look for when it comes to your probiotic. I have a lot of videos on this. Don't forget to watch those as well. So, why do you even need a probiotic? Let me tell you, you don't need one. I'll tell you, you absolutely do not need one. I personally do not take a probiotic because I feel like I'm pretty good. I'm pretty healthy. I poop great. TMI, it's okay, but I do poop great. I don't think I need one. And if you don't feel like you need one, don't do it. But for some of my patients who have reflux, diarrhea, constipation, IBS, Crohn's, colitis, sometimes taking a probiotic can help out. Probiotics are supplements. They're reinforcements to your gut to help improve what's going on inside your GI tract. They're like a secondary force to the guys already in there to help fight off those bad guys so we can hopefully get your GI tract taken care of. And so if you're having GI issues, consider trying a probiotic under the guidance of a doctor or a healthcare provider to see if this may help out for you as well. So choosing the right strain can be very complicated. It can be very confusing, and it's hard to know because I'll tell you frankly, we don't have a lot of good studies on what are the best probiotics that are out there. We have a lot of studies that are out there, but we don't have any good information for that. And also keep in mind, the problem is that everybody's gut microbiome is different, meaning my gut microbiome is maybe different than your gut microbiome. Meaning, so what my needs are may be different from your needs. And having one probiotic to fix me and you may not be the best thing for you. But here are my tips that I recommend when it comes to using a probiotic. Number one, get one from a reputable source. So Nature's Way is a fantastic source. Costco, they have good. The Kirkland brand is very, very good. So find one from a very reputable source that's done other medications when it comes to helping out with your gut microbiome or other GI issues as well. Number two, make sure it has the particular strains you're looking for, whether it's Bifidobacterium or Saccharomyces or any of the other strains you're looking for. Find the strain that you need. And I have a lot of videos on this so you can find out exactly what you're trying to treat and get you taken care of. Number three, find a simple probiotic. I've seen probiotics out there that are so complex. They need to be refrigerated. They need to be cut up in 3 different pieces. They need to be eaten before meals and after meals. No. Find one that was simple, easy to use, once a day, non-refrigerated. Make it easy for you. Next, make sure it's enterically coated. It is no point of the probiotic being released in your stomach because that is not where the gut microbiome really is. It's in your small intestine and in your colon. So make sure it is enterically coated so it gets released in the small intestine and in the colon so you don't have the pre-release before it should be as well. And make sure it also has a significant number of CFUs, which are colony-forming units. These are the strains and the number of bacteria that's inside the probiotic so we can hopefully get you the right ones that you need. So keep in mind, though, one important thing you have to realize is that probiotics are not safe for everyone. Let me stress this one more time. Probiotics are not safe for everyone. Here's what you need to know about that. If you have a disease in which you are already immunosuppressed, you take steroids, chemotherapy, do not take a probiotic. I have treated patients who took a probiotic on their own, that were immunosuppressed, that actually died from that probiotic. So don't do that. You never know what's in there. And if you're immunosuppressed, this is one reason to not do it. Number two, sometimes you can have too much of a probiotic to cause a lot of other issues as well. There are a number of patients of mine that take too much of a probiotic. They actually get worsening issues and issues like brain fog and get confused and they don't know what is going on. So be careful of how much you take to make sure you're not taking so much. If you want to learn more about probiotics, I would encourage you, first of all, come see me. We can get you taken care of. But also, number two, Don't forget to subscribe to my channel. I have a lot of videos on this as well. Let me know in the comments down below if you have any questions about probiotics as well. Perfect. All right. Raymond, thank you for watching. I love seeing you, and I appreciate you coming to see us on the live stream as well. All right, perfect. All right, so Deb, the psyllium husk study, you know, I did you send it to me? I'm sorry. I don't think I got it. If you can resend it again, that way I can get a look at it as well. All right, for joining me for the first time, my name is Dr. Islam. Yes, I'm your poop guru. Every Monday I go live to answer your questions. Let me know in the comments down below. If you have a question for me, let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. All right, next topic. Let's talk about Matthew Perry and ketamine. So you may have seen the news. You know, a couple of months ago, unfortunately, Matthew Perry passed away from some sort of overdose in his bathtub where he drowned. And so we came to realize recently that he was using ketamine. And this surprised a lot of people. So let's talk about this. So let me stress that I am not Matthew Perry's doctor. I did not treat him. I have no idea about the intricacies of what happened. But let's talk about the use of ketamine for depression. So ketamine is what's considered a dissociative anesthetic. So we use this in the anesthesia field commonly to help people get sedated for whatever surgery or operation that they are having. Now, what it does is that it actually induces like a trance-like state where you're kind of out of it and almost like you're having hallucinations as well, but it gets people calmer. It helps people to relax. It actually helps people whenever we're giving certain anesthetics or having a certain surgery to calm them down and to allow them to not be as anxious for the type of surgery that they're going to have. We also use it as a pain reliever as well for those individuals that we think either are have a lot of pain or maybe having a lot of pain after a surgery. So it actually has been used for depression. So in 2006, there was a paper that came out which suggested a significant benefit of using ketamine for depression. This is one of the very first times we see in the literature of the use of ketamine to treat depression. And more studies have shown how ketamine can be an effective option for both depression and PTSD. In fact, a lot of veterans are using ketamine to get them over some of the trauma they've had during war. But also some of our patients who have really serious depression, who have not been responding to traditional treatments, they're doing great when it comes to ketamine. It's like the veil is lifted. I do have to stress, we currently do not have any FDA approval of using ketamine for treating depression. But we do know it works. We do know there is a lot more evidence for this, and we're seeing a lot of benefit of using ketamine for depression. And so some people will still do this, and some people will use ketamine as a means for depression. How does ketamine work? We don't know exactly how it works with depression. We know that the onset is very rapid, but also more importantly, the side effects typically go away very, very quickly, especially with IV ketamine. The most common side effects can include hallucinations, dissociation, also changing in perception. It's kind of having that trance-like effect that occurs. And for some individuals, that can cause an increase of heart rate and blood pressure as well. Now, we know that ketamine works quickly. We also know the effects of ketamine, the side effects, go off very quickly as well. And we do know that when it comes to Matthew Perry, so far we do not think that ketamine played a role in his death, though we do suspect, that we don't know, that he may be using ketamine for other conditions that is commonly used. So moral of the story is that ketamine is an effective option when it comes to depression. We're having evidence for this, but was this necessarily the cause of death for Matthew Perry? It does not. It seems very unlikely given the rapid onset, but also the rapid release of ketamine whenever you stop taking it. And unfortunately, we don't want ketamine to be used unnecessarily, but it does seem to have some evidence to help out when it comes to PTSD and depression. Let me know in the comments down below what you guys have seen about this, what questions you have. Have you even used ketamine, or you know somebody who has, to treat depression or PTSD? Let me know. I'd love to hear what you guys have to say about this as well. All right. So Perfect. Lori, thank you for watching. Sandy, thank you for watching as well. Christina asked a question here. Is it possible to go from diarrhea to constipation and diarrhea back in the same day? Yes. Welcome to the life of an IBS person. 100% it is, and this is very, very, very common. I have a lot of patients that fluctuate between diarrhea and constipation every single day, almost every single bowel movement. So here's what we need to do. We need to find out what is the most predominant symptom. And so I have found in my practice, very commonly, treating the constipation first will get things going and flowing. And so what we think is going on is that you actually may be so constipated that stool is passing through that area to cause you to have diarrhea. And so that's why you have diarrhea. It's called overflow diarrhea. And so paradoxically, when you're having issues like this, I want you to go. I will make you go. I'll make you go. I'll make you flow. I'll get things going. And I found this to be a very effective way to break that cycle of diarrhea, constipation, diarrhea, and constipation. And it is very common in my IBS patients. And sometimes just getting you going, getting you flowing will break that cycle and get you feeling better. It's a great question. I'm glad you asked this. Let me know in the comments down below. Have you suffered as well from this fluctuation between diarrhea and constipation? And what did you do to help out? I'd love to hear what you guys have to say. All right, guys, and thank you for watching today. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Let me know if you're watching this live or on the replay. And also let me know where you guys are watching this at so far. Look at that. We got 50 likes. You guys make me happy. I'm so excited for that. Thank you guys for watching that and for commenting as well. If you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. Every Monday I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, subscribe. And if you haven't already, don't forget to subscribe to my channel where I can go and give you more information. All right, next topic. We will talk about Johnny Ray Walker. So he got diagnosed with colon cancer at the age of 32. That's crazy. So you may have seen this. I don't listen to country music. In fact, I don't like country music, even though I'm from Odessa. But I got a lot of people talk to me and ask me about this. So what is going on? So as you guys may know, we're seeing a rise of colon cancer in younger individuals, and we don't know why. We think it may be a combination of diet. It could be also a combination of the environment. It could be a completely different disease entity. And because of this rise of colon cancer, we actually changed the screening guidelines from 50 to 45, 5 years before. And so we don't know exactly what is going on. But recently, Joshua Ray Walker, he got that diagnosis of colon cancer at the age of 32. So what do you need to worry about? Here's what you need to know. So number one, keep in mind that colon cancer can occur to anyone. The youngest person I diagnosed with colon cancer, unfortunately, was in the 17 years of age. And so colon cancer can come anywhere. Number two, you can have colon cancer even if you don't have a family history. Yes, you can have mutations that can occur that can cause issues to be in your colon. Number three, watch out for the signs of colon cancer, colon polyps. The biggest symptom for young individuals to have colon cancer is rectal bleeding. This is why I stress, don't ignore bleeding. Don't assume it's a hemorrhoid. Don't assume it's a fissure. Rectal bleeding is never normal. It needs to be evaluated. Come see us at Lubbock Gastro. We can find out exactly what's going on and get down to the root cause of why you're having the bleeding. And this is literally the most common reason why people, or the most common symptom of colon cancer in younger individuals. So I hope that he does well. He's going for surgery in January. Hope he does well. And I hope this raises the awareness of defeating a cancer that we should not have, that you can prevent by being aware of the symptoms and getting your colonoscopy. By far, the most effective way to prevent colon cancer is to get your colonoscopy, that we can find it before you have any issues in the future. All right. Perfect. So, Sandy, that's a good question. All right. Next, so if you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. My passion is to give you guys the best tips and tricks so you can live your best life from the top all the way down to the bottom right there. If you haven't already, smash that like button. We're at 63 likes. Can we get to 75? Let's see if you can do it. Let me know if you're watching this live or in the replay and where you guys are watching this at as well. Let's see here. So Sandy asks, what diseases in the lower GI tract can cause weight loss? Great question. So unintentional weight loss is not normal. And if you have this, you need to see somebody to find out what is going on. The things that we worry about when it comes to weight loss from the lower GI tract is something growing inside that colon, whether it is a colon polyp or even a colon lesion like a colon cancer, or sometimes an inflammatory condition like Crohn's or ulcerative colitis. These are typically associated with other symptoms as well, maybe pain, bleeding, diarrhea, but unintentional weight loss is never normal. And this is something that needs to be investigated to find out what is going on so we can get that taken care of for you as well. So if you're having unintentional weight loss, come see us at Lubbock Gastro. We can investigate what is going on and hopefully get you taken care of. All right. Perfect. Oh man, we're having a great show today, guys. Thank you guys. All right. Next topic. 9 drinks that'll make you poo immediately. Yes, say what? Oh my gosh, yes. All right. I know you guys may be having issues with constipation. Trust me, I know it. I hear it. I see it in my clinic. I get the DMs. I get the messages. I'm going to give you the 9 drinks that can make you poo better and get you flowing. Or if you're having diarrhea and you're having these drinks, stop it so we can get your diarrhea taken care of. So let's talk about this. Drink number 1, coffee. Oh yes, coffee. The magical way to make you poo. So coffee is a stimulant for your gut. It helps to contract things, helps to move things along. It acts as a laxative. So when I need to go in the morning, guess what I have? I have my good old cup of Joe. And if you're having diarrhea, you're wondering why, stop the coffee. This may be the reason why. Or if you're having constipation, add in coffee to get you going and flowing. That's drink number 1. Drink number 2 is prune juice. So prune juice and prunes are very effective options that are natural to get you going and flowing. Why is that the case? One, it has sorbitol. Sorbitol is a sugar that can draw in that water and allow things to pass through and help out with contraction as well. In addition, it has magnesium and potassium, which are electrolytes to draw in that water as well to get you going and to get you flowing. Now, not only that, prunes have my favorite ingredient, fiber, both soluble fiber and insoluble fiber. And that combination can drag that water in and hopefully allow you to have much better bowel movement. So if you want to do what you can to help out with your poo, if you're having constipation, have a glass of prune juice to get you going and flowing. Number 3, magnesium citrate. Magnesium citrate is over the counter, and it's a very effective option when it comes to constipation or make you flow a lot effectively. The biggest side effect with magnesium citrate, besides causing diarrhea, is that citrate taste can give you kind of that acidity. So if you're having acid reflux and you're worried about that, you may want to hold off on taking magnesium citrate. Maybe trying other magnesiums can help out when it comes to get you going and flowing as well. Now, maybe having about 10 ounces of water may be the first option for this to help you have better bowel habits. Number 4, baking soda. So baking soda actually has ingredients in there to help out with reflux, but also to help out when it comes to get you going as well. So if you're taking baking soda for other conditions like heartburn or kind of indigestion, you may come to realize that that's making you poo a lot. And that is normal. And so you may want to minimize that to hopefully allow your poo to not be as watery or to make sure that you're not having too much diarrhea as well. Number 5, lemon juice. Lemon juice has vitamins and minerals, but also has a stimulation to help with the contraction of your gut to move things along. And so if you have lemons in your drink, or if you have lemon tea or something with lemons, that actually is going to cause you to go more frequently and more often as well. So kind of keep that in mind when it comes to that. Number 6, kefir. Let me know in the comments down below if you've heard about kefir. So kefir has been shown in studies to accelerate colon transit, to move things along. Kefir also is a very effective probiotic and prebiotic. And if you're able to tolerate kefir, I would recommend adding this every day to your diet. I personally do not like the taste of kefir, so I don't drink this myself. But for those individuals that do, it can help with constipation and allow the flow of things to pass through a lot easier as well. Number 7, kombucha, buchu, whatever I always say it wrong. But this is also a very effective fermented drink that has both prebiotics and probiotics in them to get you going and flowing. It works great. However, there's no official evidence that it can help out with bowel issues. There's a lot of anecdotal evidence that can help out. Keep in mind that this drink has caffeine and it has sugar, so kind of be wary of that. So you're not taking anything that's going to cause too much of that side effect. Next is castor oil. Castor oil is derived from castor beans. It is a very effective option. In fact, it's FDA approved as a stimulant laxative. So sometimes adding 1 tablespoon in a drink can get you going. It does not have a good taste. It tastes like petroleum jelly. So if you want to try it, that's fine. But it also works out very effectively when it comes to constipation. And then lastly, number 9, herbal teas. I am a huge fan of herbal teas. They work to get you going and to get you flowing, which is what we want to do. I feel like I'm in a Geico or in a ad, the progressive ad, with flow. I want you to flow like flow. So herbal teas that I recommend, they include peppermint tea, ginger tea, black tea, green tea, chamomile tea, whatever peppermint tea you can have, use this to get you flowing. These are 9 drinks to help you poo more, to get you going and having better bowel movements, especially if you're constipated or if you're having diarrhea. Try to minimize that so we can hopefully not have the diarrhea issues get worse for you. Let me know in the comments down below if you tried this. Has it worked? Has it helped out with your gut issues as well? All right, perfect. All right, guys. Ahmed, thank you for watching. Roselia, thank you for watching. Sandra, thank you for watching. Yes, I appreciate you guys. So thank you guys for watching that. Sounds good. All right. Perfect. Last topic here we'll talk about. I have a lot of patients ask me about procedure questions as well. So let's talk about this. Upper endoscopy, EGD. What is this? So if you've been diagnosed with an upper GI issue and your doctor told you, hey, I want you to get an EGD, what does that mean? Well, in this video, we'll talk about the specifics of this. EGD stands for esophago, gastro, duodenoscopy, which basically tells you where you're going to go. Esophago is esophagus, gastro is the gastric or the stomach, and duodo is the duodenum. So we go from the mouth to the esophagus to the stomach to the very beginning part of the small intestine. Why do we do an EGD? Well, our job with an EGD is to find out what is going on when it comes to your gut issues. So we can take a physical look, see what's going on, potentially do some treatment and or take biopsies to find out what could be the cause of your problems. Is this test uncomfortable? Typically not, because you are asleep. We give you sedation to put you to sleep so you don't remember anything, but most importantly, you don't feel anything. And it does not matter if you have a gag reflex, because you will be asleep. You will not be gagging on anything. We want to make sure that you are asleep before we put that tube down, because I do not want you to be awake fighting me whenever you're trying to put that food down or whenever we're trying to put that tube down, so we can find out exactly what is going on and get you taken care of. Now, with any procedures, there are complications. With an EGD, the biggest complication can be causing a tear in the gut. It is incredibly rare for this to happen because it's typically a quick procedure, 15 or 20 minutes. It's a very thin scope, and more commonly, we're just using this to see what's going on, maybe take some biopsies. However, there is that small risk that is there. Otherwise, it's a great way to get you taken care of. At Lubbock Gastro, we want to make sure you're safe and comfortable. And so if you're having any upper GI issues, come see us where we can do the EGD, find out what's going on, and get you guys taken care of. All right. Woo! 7:45. I am exhausted. I want to thank you for watching today. If you haven't already, smash that like button, like, share, and subscribe. If you like what you're hearing, if you like what you're seeing, subscribe to my channel, subscribe to my newsletter. Come see us at Lubbock Gastro. We can get all the information that what you need to get your health taken care of. Thank you for watching. Next Monday will be the holidays. It'll be Christmas. I will not go live, but I'll see you guys in the new year. I think it'll be the new year after that. Hope you guys have a great 2023. Hope you guys have a great 2024. Love you guys. I'll see you guys in a couple of weeks. Thanks and take care.